I am Dr. Sriram Ramalingam, eye surgeon. I have more than 30 years of experience. I am the medical director of Pradnya Nethralaya, located at Nagar, Bengaluru. Cataract surgery has come a long way. It started way back in the time of Sushruta, what was called as couching. Then it progressed to what is called as intra-capsular cataract surgery, where the human lens was just removed in toto. No lens was placed in the eye. Then came the procedure of what is called as extracapsular cataract surgery, where lens bag or the capsular bag was left behind and a lens was introduced. The first lens was introduced way back in 1949 by a doctor called Dr. Ridley in UK. From there, the intraocular lenses technology has jumped leaps and bounds. It started with what is called as a rigid lens, which is made of some plastic material, which was placed after an extracapsular cataract surgery, where the incision size was about 6 to 6.5 millimeters, and a rigid lens was implanted into the capsular support. As technology of cataract surgery improved, the newer treatments, what is called as phacoemulsification or microincision cataract surgery, the incision size became smaller and smaller. Nowadays, cataract surgery is done using phacoemulsification through an opening of about 1.8 to 2.2 millimeters or a maximum of 3 millimeters. The intraocular lens technology has also kept pace with this phacoemulsifications. So then came the introduction of what is called as a foldable lens. The foldable lenses are made up of either silicone or what is called as hydrogel material. They are usually 6 to 6.5 millimeter lenses which are folded or what is called as unfolded and injected into the eye to a 2.2 or 2.8 millimeter incisions. So these are what is called as a foldable lenses. The difference between the rigid and the foldable lenses, first is the material. Any day, the material of foldable lenses are far advanced as compared to the rigid material. The incision required to implant a rigid lens is around 5 to 5.5 millimeters, whereas a foldable lens can be implanted even to a 2.2 to 1.8 millimeters. So, foldable lenses are much better than your rigid lenses. Occasionally, it may not be possible to put a foldable lens. That is the time, many a times, a rigid lens is implanted. But 90 to 99% of the time, people go in for the foldable lenses because of the material, because of the technology that is behind the manufacturing of these lenses.